Welcome to ANS 2025. We are here in Boston. Can you please introduce yourself?
My name is Kyle Wu. I am a neurosurgeon at The Ohio State University, specializing in skull-base and pituitary neurosurgery.
Can you tell us a bit more about your experience with ARveo?
Sure. Yeah, the ARveo is a microscope that we recently acquired at The Ohio State University, and it's been an excellent addition to our fleet of microscopes. Really, mainly the advantages that we've seen in our practice has been the optics, especially for the observer. We feel like the light and the ability to see from our assistants has been exceptional. The autobalancing after draping the microscope has been phenomenal, especially because a lot of the times we take advantage of the microscope's head being able to move at extreme angles. In addition, the FusionOptics system has been really great for us. The ability to have high resolution with broad depth of field has allowed us to really do surgeries quickly, safely for our patients.
And what is your experience with MyVeo?
The MyVeo headset that we use has been an excellent addition as well. Mainly a couple areas, education and ergonomics. When we do the procedures and we have the MyVeo available to us, with our residents and trainees, fellows, even other attendees and other faculty, we can use the MyVeo to give the first-person experience that the surgeon has through the headset. The ergonomics is another aspect that we really like from the MyVeo. It allows you to keep a very neutral posture, a very comfortable posture while operating. With an advanced assistant, you can wear the MyVeo as that assistant to hold or retract tissue for a primary surgeon, and you don't have to crane your neck into the microscope as the assistant the whole time. So we found that to be very valuable. Lets you get close, lets you have your perfect balance of your arms and the extension and flexion, and you can work right into the field with the primary surgeon, completely ergonomic.
Have you used MyVeo for many applications, and which, in your opinion, are the applications where you see most of the benefits?
The major benefits with MyVeo are assisting. I found to be very helpful with the MyVeo. So we can act as a trained assistant to a trainee and get an exact idea of what they are doing, make sure that they are doing it safely, and in addition, facilitating the procedure by also having your hands in the field. Now, certain procedures, especially ones with challenging patient positioning, for example, a sitting position, have been made much easier with the MyVeo.
What would be your recommendation, suggestion to your peers to get used to this new technology?
I think you just have to use it. All right, just like any new technology, adopting takes some guts, and it takes the willingness and the patience. Also, patient safety is obviously our primary concern. So making sure that if you are going to try to adopt the technology, doing it in the right cases, the right aspects, and the right times of the cases. I think that is crucial for making sure that you can implement it into your practice in a safe fashion.
What about the market? I mean, market is moving more and more from optics to digital. What is your point of view about that?
Oh, I completely agree. I think the laws of physics dictate where we're capped off from traditional microscopic views. Digital, the ability to add in augmented reality to change the views, the images, and make them better, make them specific to a surgeon and their particular views and tastes, maybe their own contrasts and how they view a surgical field. That's something that's unique that only digital can do.
Thank you so much for your attention. Stay tuned.